Live, love, learn, life. Welcome to 4L Education. Hi again, my name is Jim Oberlander. I'm a clinical nurse faculty, and I'm continuing a series on the clinical nursing environment, clinical nurse teaching. In this posting, I want to discuss something very simple: time. That's right, time management is a huge asset to practicing nurses. So how do we as instructors teach time management? I know I struggle with it at times. I know you probably do too. But then how do we encourage, how do we communicate, how do we teach, train students to better grasp the importance of time management and then to control it? Truthfully, this is one of those areas that I'm not sure I even have the answer. It's a tough thing to teach, especially when you have 6, 7, 8. I know some of my clinical environments, I've got 9 students. Our state even allows 10. I can't imagine teaching any group of students that has 10 students in it. But that's our environment, and that's what we have to work with. Again, time management is one of those areas we have to train. And one of the areas I try and teach that to students is in their care, in their treatments, such as finger sticks. I know I'll let students process through their day. I keep an eye on their patients, keep their eye on their meals, and I'll allow students to get caught up in whatever they're doing and forget a finger stick. Now, I don't forget that the patient didn't get it, so I actually get the finger stick, and then I'll go find the student later and ask them. So I'll ask them questions, just like in our last posting. I'll ask them, so is there anything you need to tell me? Any treatment, care, updates on your patient that you'd like to share with me? And a lot of times in that environment, that training moment, they'll either realize they forgot the finger stick or not. If they didn't realize that they forgot it, then I talk to them about the importance of organization and making sure that we're getting care taken care of, treated the patient's interventions at the proper time. And if they did remember, but they're like, oh man, I'm so sorry, I got wrapped up in what I was doing and I just totally forgot about the finger stick, but I have it written down to do it on my sheet of paper, but I just forgot. And I just say, no problem. I got the finger stick, but let's talk about your time management. Let's see what you can do differently next time to maybe not make that same mistake. I want you to realize the mistake was made, but I want you to learn from that mistake. Students need to have that freedom to struggle with time and learn from their mistakes. Other ways, like I said, multiple patient assignments and questions based on prioritization. I know that the NCLEX is huge prioritization questions. Vast number of questions are on prioritization. So what would you do next? How would you handle that? What if A happened? What if B happened? What if C happened? How would that change your implementation, your nursing process, from ADPI, assessment, diagnosis, plan, implementation, evaluation, and reevaluation and reevaluation? How do you manage that in the course of your day with multiple patients? Secondly, I'd like to address your time management. I know that new nursing instructors, and I was there, I remember those days where I tried to do too much. I wanted to have a good reputation on the floor, and I thought the best way to do that was to do as much as I possibly could for the floor. Say the floor is short-staffed that day. I'm going to do more with my students. And what I found was I actually hurt the students' growth because I was starting to take over doing things because I could do it faster. So they were missing out on the education that they were paying for, and the floor was starting to get comfortable with having an extra nurse on the floor. So I want you to realize that your time management, your purpose for your time on the clinical floor is not to help the staff. It happens, but that's not our priority. Our priority is the student, their learning, their processing, engaging with their comprehension of the clinical practice. That's what we're there for. Many instructors are unsure of how to let students wrestle with this and wrestle with making mistakes. And a lot of nursing instructors, I know I did, I struggled with making mistakes of my own. We all need to learn from mistakes. We all need to realize that to err is human, as the IOM says, but we don't want to make too many. So let's learn together to manage our time, to help our students learn to manage their time so that the patients receive the best optimal care that they can receive. See you at our next field trip location. Adios.